name is Dr. Scott Stoll. I'm a physiatrist, which is a specialty that involves musculoskeletal medicine. I specialize in spine and sports medicine, and really an emphasis on more holistic care and looking for long-term solutions. Well, actually, I was born in Colorado and trained in Colorado, undergraduate at Colorado State University, and then I went to the University of Colorado Medical School for both medical school and my residency training before making my way out east to the East Coast here in Bethlehem. You know, in my fourth year of medical school, I was trying to sort out what I was going to do with my life. And so as I was looking at all the different specialties, I really enjoyed surgery. But at that time, I had a wife and child, and I wanted to spend more time with them. And so someone introduced me to physical medicine, which was a really nice combination of anatomy, some procedures, but also a more global or holistic approach, which kind of fit with my personal philosophy. So some of the conditions that I treat, it's actually a wide variety. I see neck and back pain, both acute and chronic. I see other joint symptoms, shoulders, knees, elbows, ankles, because of my sports medicine background. I do things like prolotherapy, which is trying to strengthen the ligaments that hold joints tight. I do things like platelet-rich plasma, which is injecting your own blood back into injured tissues to promote healing. Low-level laser therapy to promote healing once again. So we do a variety of things that are all geared toward restoring function and health in the musculoskeletal system. The most common condition that I see is predominantly back injuries, both acute and then some chronic. I'm always with an emphasis not only on treating the acute problem, but getting people back to their lives and prevention. And I always tell my patients that when you see me, my goal is to get you better so that you don't have to see me here again. You know, there's some really distinct differences about coordinated health, and it's one of the reasons that keeps me here. It makes a difference, I think, when people can enter the system, they can see me, obtain an MRI within a couple of days, see a physical therapist, and then follow up again with me within the week's time, and all of our notes are coordinated and all of the information is accessible. We really try to focus on not only trying to manage the acute symptoms that are a limiting factor, but also in coming up with long-term solutions, both looking at healing and bringing some balance and stability and strength to the body so that any underlying conditions don't continue to cause future problems. The system is fantastic. It is so efficient and streamlined, and I think more cost-effective than other healthcare systems. At the heart of wellness is nutrition. Nutrition is the foundation for health. All of our cells, 100 trillion cells, depend on the food that we put into our mouths for their health and their normal function. It is really just coming down to some of those basic level decisions and understanding that everything we do will have a long-term consequence. Some of the hobbies and things that I enjoy doing outside of work include, first, with my family. I have 6 children, ages 14 down to 10 months. So when I come home, I've got 6 little lives that want to go do everything from bike riding to playing in the backyard, hiking, fishing. So we do a lot of activities, and most of them are integrated with the family. I enjoy reading, I enjoy writing, and I do a lot of speaking around the country in my free time as well. I love the body. I'm always fascinated by the incredible complexity of our body with 100 trillion cells and how it all works together. And I love the mystery of researching and trying to figure out what can I do to more effectively help the body heal itself. One of the greatest joys that I receive each day is when people tell me thank you. When a little lady gives me a kiss on the cheek because I've helped her, that's the greatest reward that I could receive from my job. So I love to help people regain quality of life. I love to see people return to their lives and activities again. I love to see old people playing with their grandchildren. That's what gives me joy.